Good morning, students. In today's video we will study about the knee joint motions. In the previous two videos we have studied about the articular surfaces and the important angles. In the second video we have studied about all the ligaments, joint capsules, menisci and their important function in the movement. And in this video, the last video on biomechanics of knee joint or knee complex, we are studying about the motions, knee joint motions, how the motion or the movement takes place. Now we understand that there is 3 degrees of freedom. It is having 3 degrees of freedom, that is it has got the 3 translatory and 3 rotatory motions are there. Its axis is trans-epicondylar axis is there. That means it is passing through this. Can you understand? This axis is passing here. That is, it is a trans-epicondylar axis is there. And in this axis is instantaneous axis. That is, during the motion, the axis is keep on changing. So that is why it is having a 3 translatory and 3 rotatory motions. Fine. That means its resting position of the knee is 25 degree of flexion and the close back position of the knee is full extension. Fine. And if we see that the range of motion, ideally it is flexion which is 135 to 150 degree and extension with 0 to 5 degree. 5 degrees for the extension lag we are saying. And the motions are basically 2. When the tibia is fixed and the femur is moving, and when in the cases of when the person is in standing or the distal, in the cases of closed kinematic chain, and in the cases of open kinematic chain we see when the femur is fixed and the tibia is moving. So we will be studying both on this both the motions. Now if we take into consideration is when the tibia is moving, when that is when it is in a case of open kinematic chain. Now what is happening over here is when the tibia is moving, this is the joint, when it is in full extension and then the rolling and the initial, that you can see the this movement is taking place. This movement is taking place. Now you understand this condition as, you remember, just revising that the medial condyle, tibial condyle is larger as compared to the lateral tibial condyle. So the movement on the is a movement, the initial rolling which is there, initial movement which is there, that is arthrokinematic motion, starts from the medial condyle, medial tibial condyle or medial tibial plateau, as well as the medial condyle. So what is happening over here is the initial rolling movement is taking place, and since, remember this, the fixed is convex structure and the concave structure is moving. So what is happening over here is when the tibia is moving posteriorly in the knee flexion from extension, in knee flexion the tibia is moving, or the distal end of the tibia is moving posteriorly, and you find that there is a pure rolling movement which is taking place in the condyle, and we find that the tibia is also moving posteriorly. The tibia is also rolling posteriorly and gliding in the same direction posteriorly. Fine. And when with the extension the tibia is rolling interiorly as well as the rolling and spinning anteriorly. So this is the motion which is taking place. Let's go through the slide. In full extension, the initial phase of flexion is pure rolling. The degree of pure rolling varies with per condyle. The medial condyle rolling is you can see 10 to 15 degree and the lateral condyle rolling is 20 degree. Now the 15 to 20 degree rolling corresponds to the normal flexion extension of the invoking. So tibia glides, there is the movement is, the rolling is also posteriorly and the gliding is also posteriorly. Fine, because the concave surface is moving on a convex surface. So that means the rolling and gliding will take place in the same direction as the bone is moving, or the arthrokinematics is in same direction as the osteokinematics. Now what will happen in extension? Now you can see the figure. You see that the tibia is rolling anteriorly as well as gliding anteriorly. Fine. If we go in detail about this, in this slide we are talking about in the case of, can you see this figure? This is about when the femur is moving on tibia, that is in a closed kinematic chain. If you can see this figure, here we are talking about the femur is moving on concave tibia, Now herein, since the convex surface is moving on a concave tibia, then what is happening is the rolling and gliding will take place in the opposite direction as compared to the bone movements. That means when the femur is moving, the distal end of the femur is moving on a concave tibia in flexion, what will happen is there will be the movement will be gliding will be in the opposite direction. Now if we take in this into consideration, if you take this into consideration, you will see that what is happening is during flexion, if the femur is moving, where the femur is moving posteriorly, we take this also along with this. Herein we were talking as femur is moving posteriorly. When the femur is moving posteriorly, the glide is taking place anteriorly. The femur is moving posteriorly, the glide is taking place anteriorly. When the femur is going anteriorly, the glide is taking place posteriorly. This is the motion which takes place in a closed kinematic chain. Fine, you can see this in this diagram. When it is rolling posteriorly, the gliding is anterior. When it is rolling in extension, when the femur is going into extension, that is an anterior roll, the glide is posterior. Fine. Now what is the role of these cruciate ligaments? Now the role, basically, if you remember, there was an orientation of these anterior cruciate and posterior cruciate ligament. It was having two bundles. Now basically, to just memorize you in this, these anterior cruciate ligament are both, anterior cruciate ligaments are active in knee flexion, whereas posterior cruciate ligament is responsible for preventing the hyperextension or holding the valgus and the varus stress in extension. So in knee flexion or whenever the knee moves, anterior cruciate ligament is active. Fine. And if you see the orientation, it can be also be said that in extension and both of them are active, but in holding the varus and the valgus stress, this can also be said. The cruciates are both active. But here I will like to add that the posterior cruciate ligament was giving us the medial rotation stability. If I am right, sorry, it is a posterior cruciate ligament was giving us the lateral rotational stability, whereas anterior cruciate ligament was giving us an medial rotational stability or the medial stress, medial rotational stability and the lateral rotational stability by the posterior cruciate ligament. The posterior cruciate ligament was also active in knee flexion. It was active in it was active in let me see. Yes, it is in airplane mode. Okay. Now it was active during the 80 to 90 degree of knee flexion. The posterior cruciate ligament was active and it was stretched, totally taut, and it was providing valgus to varus stress. It was giving resistance to valgus and varus stress. So just just revising the posterior slide. Let us continue reading it. You can see the orientation. These are all the fibers which are oriented. You remember the anterior cruciate ligament was an oblique fiber which was running anteriorly, and medially, whereas the posterior cruciate ligament fibers were almost vertical, postero, and laterally it was running. Fine. So you can understand from that inferior posteriorly they were basically going, and herein this orientation is responsible or is helpful in during flexion and extension. When the knee is 90 degree flex, the PCL, we also remember that the anterior and interior cruciate ligament is restraining from the interior translation of the tibia, and the posterior cruciate ligament is restraining or is preventing the posterior translation of the tibia. So this is the first function which the cruciate ligament is doing. One, when the knee is flexed to 90 degree, PCL is preventing the posterior gliding of the tibia on femur, and ACL is preventing the interior translation of the tibia on femur. Second is about the orientation. The orientation is about in flexion, the PCL is almost, I want to show another figure. Yes, this is the one. This I wanted to show you earlier also. Now if you see, if the knee is extended, you can see both are taut. Can you see? The both are taut. That means both ACL and PCL. This is the both ACL and PCL. This one is ACL and this one is PCL. Fine. Now if you can see this, the PCL has become in 90 degree of flexion. The PCL has got a vertical orientation, whereas ACL has got horizontal orientation. We are talking about that. In full knee 90 degree bending condition, the PCL is vertical, has got vertical fibers are almost vertically oriented, and the ACL fibers are almost horizontally oriented. Fine. You can see this in diagram when 90 degree bend. So the instantaneous axis has changed. Whereas you see over here, it is going to that. It is going into this. That is, it is going into the orientation of the fibers. Can you see? The orientation of fibers has changed. Fine. So this is very much important. When the knee is straight, both ACL and PCL are taut. When the knee is 45 degree bent, then you can see that it is the PCL is taking the vertical orientation. It has started taking the vertical orientation, whereas the ACL has already been totally taut. Fine. And maximum taut at 90 degree. You can see maximum taut at 90 degree, whereas in 90 degree the PCL is also very taut in the vertical position. Fine. Let us read that slide now. So in extension, both the cruciates are stretched and PCL becomes less vertical, whereas in flexion the PCL is more vertical oriented and ACL becomes more horizontal orientation. Fine. So this is very much important. These fibers and their orientation is very much important. Fine. Now what is the role of the menisci in this in flexion? Now if we see this in the, I wanted to show this. Now if I take this and the forces which are acting, let us take this is menisci is acting on femur, and this is the orientation of femur is acting on menisci, and we divide it into the two components, the vertical and rotational. So you can see this is the vertical component. Fine. And this is the vertical component. These vertical components, if we take this as shear 1, this is shear 2. Fine. So you can see how the basically I'm trying to show is that this is the force with which it is happening. So that means if the menisci is acting on femur, the force of femur is also acting on the menisci. So this is how the shear 1 and shear 2 are acting on it. So if we resolve these components, so you will come to know it is oblique direction. That is the orientation or the force which is acting on exerted by the menisci on the femur during flexion activity is oblique in nature. So we have to resolve it into two components, and when we find this and we see that there is during flexion the compressional forces that is it deforms the posterior surface of the menisci. That is the posterior, whenever the flexion of the femur takes place on the menisci, the posterior deformation or the posterior surface or the posterior part of the menisci is deformed, and the interior because the femur moves on the interior part and the deformation takes place on the posterior part. This is because of the oblique orientation. Let us go through this. In femur flexion initial range, femur moves actively on menisci. Increasing the flexion in menisci exerts a force on femur which is in oblique direction, as I showed you here. So we resolve the components into rotatory and translatory component. The flexion on menisci, a compressional force acts on the menisci. Of course, when the movement of the femur takes place on the menisci, there is a kind of a compressional force, and you see that it deforms posteriorly as the femur flexes. When the femur flexion is taking place, when the femur is moving behind, there is a deformation force posteriorly. Let me show you here in this form. That is when the flexion, when the femur is moving behind. When the femur is moving behind, you can see, and if I can show you posteriorly. Okay? When the femur is moving, that is when the flexion is taking place. When this flexion is taking place, the deformation, since the movement is taking place anteriorly, that means the condyles, they are rolling, the condyles are basically rolling, but the gliding is taking place posteriorly, and what is happening is it is causing a distortion of the menisci posteriorly. Whereas opposite is there in extension, the menisci is deformed anteriorly because the rolling is taking place anteriorly, so it is deformed anteriorly, and gliding is taking place posteriorly. So you can see opposite happens in the case of menisci when the flexion takes place. Now let us go through this table. It will be clear, this picture will be clear when we go through this table. Now let us go read this table as when the tibia is fixed. We are talking about in a closed kinematic chain, closed kinematic chain. First one is the example of closed kinematic chain. When the tibia is fixed and the femur is moving. So when is the functional position is basically when we are squatting, and then also knee flexion takes place. Now herein what is the osteokinematic movement which is taking place? The femur is moving backwards, okay, in knee flexion. And what is the arthro movement which is taking place? It is rolling posteriorly but gliding anteriorly. This is all clear because the convex surface is moving on a concave. We have already seen the rule is because the convex surface is moving on a concave surface. Now what are the remarks which need to be kept in mind is that 0 to 25 pure rolling takes place, and after 25 the gliding takes place. Now what is the role of the ACL over here is that initially the ACL is totally relaxed. Initial knee flexion, the ACL is totally relaxed, whereas after 25 degree of flexion of knee, the ACL is taut, and it prevents the interior translation of the tibia and the femur. It prevents that. So in extension, opposite will happen. If we take into consideration, I have only taken into consideration knee flexion. In the remarks you can also see in knee extension the PCL will be taut, and it will prevent the posterior translation of the femur. And what will happen to the menisci? The menisci knee flexion will distort posteriorly in flexion, and in extension it will distort anteriorly. So this is how the movement is taking place in closed kinematic chain when the femur is moving. When the femur is fixed and the tibia is moving, that is in the open kinematic chain, you can see what we see in functional position is quadriceps stable. When we flex our knee in quadriceps stable. So what is the tibia is moving behind? The osteo movement and happens, and the rolling and the gliding takes place in the same. Why so? Because the concave surface is moving on a convex fixed surface. So opposite happens in knee. So these are the movement which is this is just a summary of what all we have discussed in the above slides. Fine. I hope this is clear with this table. I will discuss this table in the last. Now there are other movements, as I have told you. There is three movements which are happening. One is the flexion and extension. The other two movements are which we will discuss here is medial and lateral rotation. Now in a closed kinematic chain there are other movements also happening, which happens at the, now you remember this all is happening at the, is having an instantaneous axis, the trans-epicondylar axis, which is an instantaneous axis. So herein what we can see is there is a rotation which is happening. Now what is happening is, now if this is a closed kinematic chain movement, there is a rotational movement also happening. The medial condyle, this being the medial condyle, femoral condyle, this means the lateral femoral condyle. Now whenever there is whenever there is a movement which is taking place, whenever there is a movement that is internal rotation movement is taking place. Now you see that if there is an internal rotation movement is taking place, this movement causes a posterior, the movement is what is happening, rotational movement. So this is the rotational movement. The medial femoral condyle is basically moving posteriorly and it is gliding anteriorly, whereas the lateral femoral condyle is moving anteriorly. Can you see this? I hope you are able to see this. This is the movement which is happening on a fixed tibia. So what is happening over here is, this is the medial condyle. Basically, if I can say, the medial tibial condyle is acting as a medial area or condyle area is acting as a plateau, and the lateral condyle basically moves. So this is the movement which is happening. So whenever there is a medial rotation, the medial femoral condyle is moving posteriorly, whereas the lateral femoral condyle is moving anteriorly and gliding posteriorly. You know that the movement of rotation is like this. So let us first see what is the movement. Whenever the medial rotation movement takes place, the medial femoral condyle moves posteriorly, as well as the lateral femoral condyle moves anteriorly. This is as simple. Since it is a convex joint, so here the glide will take place in the opposite direction. When there is a lateral this movement, where medial femoral condyle acting as a plateau, so what is happening is this movement is taking place. So whenever there is a this movement, that is lateral rotational movement is taking place, the medial femoral condyle moves anteriorly or rolls anteriorly, and it is lateral femoral condyle rolls posteriorly. This is as simple as it can be. So these are the movements. Let us go through the slide. Transepicondylar axis, medial tibial plateau is acting as a pivot. That is the medial femoral condyle and medial tibial plateau is acting as a pivot, and there is less movement which is taking place on the medial side. The more movement is taking place on the lateral side. So what we see is lateral rotation is when the medial femoral condyle moves and where there is a rotation, that is medial femoral condyle moves anteriorly, and there is lateral femoral condyle moves posteriorly. The gliding is the medial femoral condyle rolling anteriorly causes a glide posteriorly, and the femoral condyle, you can see it glides in the opposite direction posteriorly, whereas the lateral femoral condyle rolls posteriorly and glides anteriorly. You have to remember the convex is moving on concave. Fine, so that is why. Fine, in medial rotation, the medial femoral condyle moves posteriorly and glides anteriorly, whereas the lateral femoral condyle moves anteriorly and glides posteriorly. Fine. Now what will happen in rotation? Now role of the menisci in rotation, you know that the medial, if we talk about this, and you should remember that the medial compartment is there for stress, and why so? Because the movement is very less, whereas the lateral side, the movement is more, so there is less stress. So medial compartment is always having the stress or compressional forces. So in medial rotation, the lateral menisci is distorting anteriorly. Whenever there is a medial movement, medial rotational movement is there. Now you can see there is a medial rotational movement is there. The lateral menisci is distorting anteriorly, and since it is the movement is taking place like this. Fine, and the medial meniscus is distorting posteriorly because it is moving posteriorly. Fine, so there is the lateral meniscus is just distorting anteriorly because it is rolling. So the movement which is taking place, the roll which is taking place, you have to remember the rolling position. In medial rotation, the medial femoral condyle was rolling posteriorly. Fine, so there will be posterior distortion of the medial meniscus, and the lateral the condyle or the femoral condyle was rolling anteriorly, so distortion on the menisci will be anteriorly. Similarly, when the lateral rotation was taking place, the medial menisci will distort anteriorly and the lateral menisci will distort posteriorly. In extension, all the ligaments are taut. So we see that the medial and lateral rotation is restricted in extension, whereas at flexion, that is at around about 90 degree, there is maximum amount of medial and lateral rotation which is taking place, which is more is lateral rotation, that is 20 degree, and less is medial rotation as 15 degree. Fine. Now there is a third movement also which is happening, that is called abduction and adduction in frontal plane and AP axis. Now we have talked about flexion and extension in sagittal plane. Yes, and yes, it is taking place in x-axis. Now we have talked about the medial and the lateral rotation, that is taking place in the transverse plane, and there is a we say the instantaneous axis. We will not say z-axis, but I will say instantaneous axis, and abduction, adduction in frontal plane and y-axis. Now you see this as the tibia is moving herein. When the tibia is moving, we see that there is a valgus force is always acting. That means whenever the tibia moves, the medial compartment is always distracted and the lateral compartment is you see This is the tibia. Whenever the tibia is moving, the medial compartment always have a valgus force. That is, the medial compartment is always distracted. It is always distracted. That is, it is having the valgus force. It is always distracted when the tibia is moving. Whenever the tibia is moving, it is causing a distraction at the medial compartment and compression at the lateral compartment. So that is the abductional movement which is happening. That is, the maximum is 8 degree. That is, adduction is 5 degree and abduction is 15 degree. Abduction corresponds to the valgus movement which is happening, and it is restricted by the medial collateral ligament, and adduction is the varus movement which is happening. That is, in extension you see that in extension there is a maximum amount of valgus force which is there. Whenever there is a flexion, there is an adduction force which is started. Whenever the tibia moves, there is in extension there is an abduction force. During extension of the tibia, there is an abduction force, whereas during the flexion of tibia, there is an adduction force which is movement which is there. That is the varus movement, and which has been restricted by the medial collateral ligament. We are talking about here is about tibia in an open kinematic chain. There is an abduction and adduction movement, and with the movement of the tibia, with flexion there is an adduction force, and with extension there is an abduction force. That is, abduction is the valgus stress force, and in that is abduction, and which is restricted by the medial collateral ligament, and in adduction there is a varus force which is restricted by the lateral collateral ligament. Now, this is, till now we have studied the individual motion. Individual motion means we have studied about flexion extension, we have studied about medial lateral rotation, we have also studied about the abduction and adduction movement. We have studied about the whether it is acting in closed kinematic chain, whether it is acting in open kinematic chain. Now let us study about coupled movements. Now coupled movements, there are two coupled movements around knee. What is coupled motion is a motion which is taking place in one axis as well as in association with another motion which is taking place in another axis. So one motion is taking place in one axis and another at the same time, simultaneously another motion is taking place in another axis. That is called as coupled motion. So the first example of this is the flexion is accompanied by a movement towards midline. That means whenever there is a flexion, now whenever there is a flexion, I'll give you an example. When the tibia is whenever the tibia bends, when you bend your knee, you see the tibia is coming to midline. Can you see it is already gone into midline? When I bring it to extension, can you see? Okay, it is little bit, again the deviation is there. Deviation, why so? The femur is, you understand, is obliquely oriented. Now when I bring it into flexion, what is happening is the tibia is in line with the femur. Can you see? So, and it has come out. So that means in flexion the tibia is basically coming to midline. I want to say that is in flexion of flexion movement, the tibia is moving towards the midline, and if the flexion is bringing about a adductional force or a varus stress or a varus force, that is an adduction force, whereas extension is bringing about an abduction force or an valgus force. Now you can do this practically while you are standing. When you bend your knee, you are able to place your heels just at the ischial tuberosity. Why so? This is possible is the tibia is moving and there is an adduction movement which is happening. When you try to extend your knee, when the tibia is moving in extension, you see that it is moving away from the it is moving away. That is, there is an abduction of a movement, that is a valgus of a movement. These movements are very minute, that is 5 degree of movement or that is 15 degree of movement is taking place. So this axis is transepicondylar axis, oblique axis, not in sagittal plane but more in frontal plane. This is the first coupled movement which is happening is the flexion is bringing, the tibial flexion is bringing about an adductional movement, whereas tibial extension is bringing about an abduction movement. Fine. Now or knee flexion brings about an adduction movement and knee extension bring about an abduction movement. Now the second motion which is happening is again with flexion and extension is medial and lateral rotation. Now medial and lateral rotation takes place, how it is possible is that the last 30 degree, I want to show it here again. Yes. Now when is the last 30 degree to knee extension? Now this is the movement. Now this is the last 30 degree. Now in the last 30 degree of knee flexion, last 30 degree to extension we are talking about, the medial tibial moves on a medial femoral condyle. The medial tibia is moving on the medial tibial condyle. Rolling and gliding is anteriorly. We are talking about when the knee, this is there, that is in open kinematic chain. We are saying that the medial tibial condyle is moving on the medial femoral condyle. Rolling and gliding is anteriorly, as the concave surface is moving on a convex surface. The lateral tibial condyle lies in the lateral femoral condyle, as articular surface of the lateral tibial condyle is already complete. Last 30 degree of flexion last 30 degree of flexion to extension movement, the lateral tibial condyle movement on the lateral femoral surface is already complete. As compared to the medial tibial condyle, it has got some play. So the medial tibial condyle will still keep on rolling and gliding anteriorly, whereas the lateral tibial condyle act as a pivot. So this is the lateral rotation movement of tibia. In extension, the lateral rotation, that is in 30 degree to extension, there is, I am showing it in a more form so that you can appreciate it. This is the last 30 degree of extension. In the last 30 degree of extension, the lateral condyle is acting as a pivot, and this is moving little bit. There is a anterior, that is medial rotation is taking place at the there is kind of a the medial condyle is moving. There is a kind of a lateral rotation which is taking place at the medial condyle. That is called as the screw hole mechanism or the locking of the knee. Let me go through this again. In the last 30 degree of flexion to extension, the medial tibial condyle moves on medial femoral condyle, rolling and gliding anteriorly, concave on convex. The lateral tibial condyle lies on the lateral femoral condyle, as articular surface of lateral tibial condyle is complete as compared to the medial tibial condyle. So the medial tibial condyle will continue to roll and glide anteriorly, whereas the lateral condyle act as a pivot. This rotation is lateral rotation of the terminal rotation is called as the screw hole mechanism or the locking of the knee. That is, the terminal extension is brought about by the lateral rotation of the medial tibial condyle, that is on the femoral condyle. Fine. So it is brought about by the terminal extension is accompanied by the lateral rotation of the medial tibial condyle. So this is the locking of the knee. The unlocking of the knee is, that is from the extension, full extension to flexion, initial flexion. The medial tibial condyle will now rotate medially, and then the flexion will start. This is the initial flexion, which is accompanied by medial rotation, is called as unlocking of knee, and this is also been held by popliteus muscle, and because of its oblique orientation, that is why it is called as automatic contraction. It is also called as automatic contraction. The unlocking of knee is called as automatic contraction, and the locking of knee is called as the screw hole mechanism, or the unlocking of the knee is lateral rotation, extension with lateral rotation, and the unlocking of the knee is flexion with medial rotation. Now to sum up this, I want to read this slide with you guys. This is the tibiofemoral arthrokinematics. That is, the first one is for the closed kinematic chain, when the convex surface is moving on a concave, that is the femur is moving on a fixed tibia. Now the flexion of the femur causes the flexion is, you can see the flexion here is, the femur is, we are talking about femur moving. When the femur is moving in flexion, you see it is causing a posterior roll. There is a posterior roll of the proximal end. The femur is moving, there is a posterior roll of the proximal end, and there is a posterior roll of the proximal end, and there is an anterior glide. So the glide, because the convex surface is moving on concave, arthrokinematics will be opposite to osteo. So you understand that the femur is moving behind, this movement is taking place, the femur is moving behind, so there is, the femur is rolling posteriorly and there is gliding anteriorly. It is bringing about, this femur is bringing about a rotational movement, that is lateral rotation is taking place. With flexion there is a lateral rotation is taking place and a varus is happening. Varus is adductional force is happening. Okay, there is an adduction and a lateral rotation which is happening, is there. Fine. Whereas in extension the femur is moving anteriorly, the rolling is, gliding is posteriorly, there is an internal medial rotation movement which is taking place, and there is an valgus stress which is added, that is, I can say, abduction movement is taking place. With extension there is an abduction movement which is taking place and there is a medial rotation taking place. This is just opposite to what we have discussed. Now what happens is, when a concave surface is moving on a convex, the tibia is the bone which we will take into reference. The tibia is moving posteriorly, the gliding is also taking place posteriorly. There is whenever there is a flexion, there is a kind of a medial rotation which is taking place, and there is an adduction stress or the adduction movement which is happening. There is an adduction or a varus movement which is happening. In extension the tibia is moving anteriorly, gliding anteriorly, there is an lateral rotation movement and abduction movement which is happening on the tibia. So this is how I can summarize this, all these motions around knee. You have to go through these tables again, and the things will be very much clear when you will go through these tables again. The first table is this, just it described the movements which was happening, and I described the role of ligaments, the cruciate ligament and the menisci, how they were getting distorted. In the second table we are talking about all the couple movements, and the second table describes the couple movements of the knee, and herein how the roll, glide and rotation and all the three movements, that is flexion. I started writing it on this slide also, but then I thought let it be another slide should be there. The flexion movement is always been with lateral rotation and adduction, but then I thought that it will be better if you understand it in another slide. So I hope you guys have understood the knee joint motions, and if you have got any doubts, I am there to clear that. You can put a comment in the video below this video, and I will try to reach for this and try to solve your any doubts. Thank you guys.